Now we have something called, let's look at some of these different group of disorders, what we call mood disorders. Of course, major depression come into it, feeling of sadness, helplessness, and these are signs and symptoms, of mood disorders, So again, lack of energy, feeling worthlessness, feeling hopelessness. Some people have suicidal ideas, or what we call suicidal ideation, suicidal thought, difficulty in sleeping, and difficulty getting up in the morning as well, difficulty in concentrating, and so, which means they don't eat, they have loss of appetite and loss of libido, little pleasure, and so forth. Anyway, and again, from studies done with twin studies, and adopted children as well, they look at twins, adopted children, also twin children. When they look at them, and there is some sort of genetic factors involved anyway. Risk left among relative of women with early onset of depression. So if somebody in your family would have early onset depression, the risk of you getting it is the risk is much higher anyway, among relatives of them. So this is called mood disorder. So the depression would come into it because depression affects your mood, and so forth. Now this is another big problem, although that especially when women have children after giving birth, sometimes they go into what they call the blues, anyway, the depression, and that affect women. Some women are suicidal, some people reject the baby, some women, and so forth. Again, there's mixture of different causation in terms of, hormonal problems and so forth. And so, a lot of women suffer from it, but sometimes it's a very, short onset, sometimes it's long. Some of the postpartum, you can have psychotic depression as well. People can be ill for a number of years anyway. And so it's what they call the baby blues anyway. It's very common, and but some people get it more severe than others anyway.